Hello? Okay. Start over. Stop. Me and this thing are not going to have fun. No. Why won't it open? And then stay open. Okay. Welcome to the Ohio Benefit Bank. Welcome. This is Gail with the Ohio Association of Food Banks, and this is a special addition to our Enhanced Tax webinar series. This is for all free tax sites to understand what the National Tax Credit Outreach is. And as a subtitle, we are using how tax credit outreach campaigns can assist eligible families in enrollment for new health insurance coverage. I know that's kind of long, but that's what I was given. So let's go on and move forward. I'm glad that you're here today. This is pre-recorded, so there will not be any interaction with Q&A. But if you find yourself having any questions, please feel free to email me. My email address will be at the end of this webinar. Please feel free to email me your questions, and we will get them answered and sent out to you. All righty. So let's begin. Before we begin, just a few reminders. We here at the Benefit Bank have several years of experience, but we are not experts at taxes nor public benefits. So if by chance someone comes up with a question that we do not have the answer to, we will definitely research the answer and get back with you as soon as possible. Like I said before, this is pre-recorded, so there will not be an opportunity for you to ask questions, but please email me if you happen to have any questions. The mission of the Enhanced OBB Tax Counselor Series is that we provide information on wraparound services readily available through webinars to ensure that OBB counselors have the knowledge they need to serve clients more fully. So today's agenda is we're going to talk about what is the National Tax Credit Outreach Campaign, how to incorporate the Tax Credit Outreach Campaign in your tax clinics, how to use help tools, and how to request navigators to tax clinics. We do have a guest today. You guys all know her. She is Jessica May. She has returned to the Ohio Association of Food Banks, and she is the newly, my brain just went on a freeze. She is our new healthcare navigator. She's in office here at the Columbus office. So Jessica, you want to say hi?
Hello everyone, glad to be back.
Okie dokie. So Jessica will start talking here halfway through the webinar. She will explain about the tools and how to request navigators to your event. So one of the first things I want to talk about is tax return clinics. We normally host tax return clinics in from January until the end of tax season. This year, though, some of our sites are actually going to host clinics beginning in November. The reason why we're holding them in November is that we want to be able to get out in front and help our clients as much as possible with understanding that there is a tax credit. Okay, you don't hear much in the news about tax credits. Um, you're mostly just hearing about the health care and about the fact that you must sign up for it. Okay, um, that is all that you're really hearing. You're not hearing much about how to pay for it. So that's what the tax credits are. And we'll talk more about the tax credits as this webinar goes on. But one of the things I want to point out to you is that the premium tax credit is actually set up very much like the EITC model. Okay, so it's not anything new. The model we will be used to using, but it is a tax credit. So just a reminder, at your tax clinics, these are some of the tools that you'll need. You'll need, of course, trained OBB tax counselors. You're also going to want to have volunteers, because some of the things that Jessica is going to be talking about can be actually completed with volunteers. They do not need to be trained OBB counselors. The reason why you're going to want to have a trained OBB counselor is if someone has not prepared their 2012 return, or if they need copies of their return, those kinds of things, okay? You'll need volunteers. Of course, you'll need computers with internet access and printers so that you can print off returns. Remember that we do have clinic supplies available. You can get them at the marketing order form. This is the link to the ohiobenefits.org marketing order form. We have name tags for your counselors and volunteers. We have iHeart free tax stickers. These stickers work very much like the stickers when you go to vote. Once the person has completed their taxes, you give them that sticker and let them put it on their shirt, and that's free advertisement for your site. You'll also want to make sure that you have quick check cards available and document envelopes for your clients. Okay, that way you can put all their tax forms and any other forms that they may have inside the envelope. And of course your counselor login cards, and all of these things are free through the Ohio Benefit Bank site. So let's talk about what is the National Tax Credit Outreach Campaign. The purpose of it. The purpose of it is, according to the Families USA, over 27 million Americans may now qualify for new health insurance premium tax credit. This is under the Affordable Care Act, which was enacted in 2010. The credits make private health insurance affordable for low and moderate income families and individuals. The health premium credit reduces the total amount of tax your clients will owe to the IRS, and if you don't owe, it can get you a bigger refund. You get the tax credit to help cut the cost of your health insurance. So that is basically what the health premium tax credit is. The EITC model that I spoke of earlier, remember when EITC first began, you could take it one of two ways. You could have waited to the end of the year and taken it all in one lump sum as a refund, or you could have had portions of that payment added to your paycheck each month. Okay? They no longer do that. Now you just get EITC at the end of the year. Well, the health premium tax credit, you can take it both ways. You can either take it one lump sum at the end of the year, or you can take it during the year. It will not show up on your paycheck. Where it will show up is that, let's say, for example, I've signed up for health care, and my coverage is going to be $250 a month. I can, when I sign up for my health care coverage, I let them know that I want to use my health premium tax credit to make my premium payment. So what happens there is that the IRS will send to the insurance company that I choose, the insurance provider that I choose in the marketplace. It will send to them my premium every month, my $250 a month it will send. Now, at the end of the year, if I happen to have money left over from my premiums, then I will receive that money left over. Let's say let's make this real easy for me because we all know I can't count well. Okay, let's say my premium is $100 and my tax credit is actually $15,000. Okay, they deduct $100 out of my premium, out of my premium amount credit every month, and then and that ends up being $1,200. So the difference between the 12 and the 15, that is $3,000. Isn't that right, Jessica? Huh? 300. Okay. See, I told you. I can't do math in my head. $300 left over. So when I have my taxes prepared in 2014, that $300 will be added to my refund. Okay? So I'll get that additional to my EITC if I'm eligible. If not, it'll just be that $300 plus whatever money I have left over from after having my taxes filed. I hope that makes a lot of sense for people. Does that make sense to you, Jessica? Okay, good. So that's how that works with the EI. They're utilizing the EITC model. I wanted to show this to you here. This is the Federal Poverty Guideline for 2013. Well, I think it's considered 2012 and 2013. With the health care premium tax credit, you are eligible for that credit. You have the potential, I should say, the potential to be eligible for that credit for up to 400% of the poverty guidelines. Okay? That's way more than the EITC. So if you are a single person, you may be eligible up to $45,960. Okay? If you have a family of 5, your income could actually be $110,280. Okay? So when you're working with people, do know that 400% poverty guideline is where the cutoff is with the health care premium. Now, to also help us this year, because as you can see, the income amounts are higher, the single person's income with the Ohio Benefit Bank this year, and beginning in 2013, will be $65,000. okay, for a single person. But if you are married filing jointly, okay, you have to be married filing jointly, your income can be as high as 90,000, okay, which is exciting. A lot of times we have clients and they'll say, okay, we in the past, last year, for example, the amount was $60,000. And people would always ask you, okay, so is that $60,000, is that family or per person? And you always had to say $60,000 per family. Well, a lot of our clients have two incomes, okay? And one may be 25,000, the other one may be 35,000, then that put them out of the range of actually being able to get their taxes prepared by us. But now we can go up to $90,000, but that is for married filing jointly only, okay? So we will have new advertisement, new flyers that speak to that. Okay, so just remember it's 65 if you are single, or if you are head of household, which is also single. Anything that is single goes up to 65,000, but married filing jointly is 90,000. All righty. So now it is time for Jessica. Okay, drum roll. Jessica May, like I said, she is our certified navigator. She is doing a fabulous job. So what I am going to do is I'm going to turn this over to Jessica so that she can begin to explain to you what's going on. Jessica.
Thank you, Gail. So there are a couple of websites that you're going to want to be aware of as you are helping folks through with their tax credits, because like Gail said, that advanced premium tax credit will be affecting a lot of folks we know, and they're going to have a lot of questions. Okay.
All righty. So now our guest speaker is Jessica May. She is a certified navigator for the state of Ohio, working here at the Ohio Association of Food Banks. And Jessica is going to begin speaking to you about ways to help with enrolling.
Thank you, Gail. So there are three groups of folks that you should know about who can help individuals enroll in plans in the healthcare marketplace. The first group of folks are navigators like myself. We have gone through federal and state certification in order to be able to understand and explain not only the marketplace, but also how insurance works. We are required to offer services in a culturally and linguistically competent format. So we are trained on how to work with different cultures, different language proficiencies, also with different disabilities. So please keep that in mind as well. So navigators are federally funded. So I work through the Ohio Association of Food Banks through a federal grant, and we have other navigators across the state as well to make sure that we have full state coverage. We have lots of consortium partners. You can also use certified application counselors. And certified application counselors differ from navigators in only a few ways. The first way that they differ is that they are not federally funded. Also, navigators do education and outreach activities while certified application counselors do not. Certified application counselors are still trained in the same information that navigators are, and they are going to be located at your local organizations all across the state, and they're going to be really integral in making sure that we are getting everyone signed up for insurance that is qualified for it. They've estimated that in the state of Ohio, there are about 1.2 million people who are uninsured or underinsured, so we have a lot of folks we're going to want to get to, so the certified application counselors are going to be very important in helping us get that done. Folks can also go through agents and brokers. So if, for example, United Healthcare has a plan in the marketplace, they can still help people go through the marketplace to sign up for that plan and all of that. So we don't want to disclude them from the group, so people can also go through agents and brokers if they already have a pre-existing relationship with an agent or a broker. So as community organizations, as folks helping your neighbors and your communities, you're going to be running into individuals who are going to need more information about the marketplace, about what their options are, and so I've collected some helpful resources for you. You do not have to be a navigator or a certified application counselor in order to use these. These are public links where you can find information that these organizations have created for you. So the first website is healthcare.gov, and I'm going to take you there now. So if anyone's been checking up on what's going on with the marketplace recently, this page should look very familiar to you with our smiling lady. And this is where you can go to actually access the marketplace, and also where you can look at just a general list of plans. Now you may have heard that healthcare.gov is having some issues. You can get so far and then it stops and things like that. They are working on it. They are aware of the problem, so they're asking us to just be patient while they fix the glitches in the site, which we are more than happy to do. So if you have someone who wants to look at plans but they don't want to actually start a marketplace application, there is something that you can do right here on this main page. If you see in the middle of the screen, actually more the bottom, see plans and prices in your area. So if you click see plans now, it's going to take you to a general list of plans. Now a couple of things I want to touch on when we're doing this. First of all, it's just going to give you a list of the names of the plans. It's not going to give you any information beyond that. So it's not going to tell you anything about what doctors are in the network or how they tier their prescriptions and things like that. It's just going to give you the name. It's going to give you the type of plan, whether it's an HMO or a PPO, and those are all alphabet soup in the healthcare language, and then the ticket price of it. That ticket price is also something to be aware of, because the folks that we're going to be seeing will most likely qualify for a premium tax credit. The prices shown do not include any kind of subsidy. So you don't want people to get sticker shock, because that may not be the final price for them. So with all those things in mind, you can still look at a list of plans if that's what people want to see. So you're going to answer a couple of questions. So first of all, which best describes you? So if you're looking for yourself or your family, or you're a small business, so we're going to be looking for coverage for ourselves and our families. Oops. I need to move my little control panel here. Okay, next. Then what type of coverage you're looking for. So they do have health plans. They also have dental only plans. Some plans on the marketplace will have dental and vision options as well. It's going to depend on the plans. We're just going to look for health plans to begin with. And you'll see plastered all over these screens that will say the prices here don't necessarily reflect the actual price you're going to pay. So just they're going to always try and remind you of that so you don't get that sticker shock. It's going to ask for my state, which, unless I'm mistaken, we are in Ohio, and then county. So I'll do Franklin County. Oops, I did select the county. Franklin. Okay. It's then going to ask, who exactly in your family are you applying for health coverage for? So you can choose an individual, a couple, a whole family, parents and children, children only, so that's up to you. I'm just going to search for an individual, and then how old I am. So I am 49 or under. I'm not going to tell you the exact number, but it's in that range. And then you click next. Okay. It's going to tell you about essential health benefits. And this is something to keep in mind when people are on the marketplace. In order to have a plan on the marketplace, you must have a plan that offers essential health benefits, which would include a coverage that would range from doctor visits to hospitalization to prescriptions, also include maternity care, and then preventative care or those wellness visits. So all those plans on the marketplace have to have those things. It's then going to tell you there are lower cost subsidies available, and that this page is not going to reflect those. And then it's going to describe the 5 categories. So within a plan there are different categories available, and that really just depends on whether you want a level of plan that has higher premiums and lower out-of-pocket costs, or lower premiums and higher out-of-pocket costs. And like I said, when folks sit down with navigators and certified application counselors, we'll be able to explain that to folks. So once you go through those couple of explanation screens, you'll then be given a list. So for someone who fits the bill for what I was looking for, there are 34 health plans available. So I'm just going to scroll down so we can see a couple of them. Like I said, you can do this yourself, anybody can. So I can see on this first plan, the plan name is Market Young Adult Essentials. It's through MedMutual. It's a PPO plan, which means that there's a preferred provider network, and it's a catastrophic plan. Catastrophic plans are very specific for younger individuals, and it's going to have very low premiums and very high deductibles. So then you see on the right-hand side, the estimated monthly premium for me will be $150.55. Now remember, that does not include any kind of subsidy that I might qualify for. And you can go through the whole line. You can go through all 34 of them. You'll see that they show them in chunks of 10. So I can just, at the bottom, click Show Next 10, and it'll pull those up as well. So that's a helpful tool if people just want to see plan names. So like I said, there are several disclaimers that are going to be going along with this. You know, you can't actually look at the plan in depth, and it's not going to reflect any kind of subsidy amount. Okay. If someone does want to go straight into the marketplace, on the main page, healthcare.gov, you can apply online or apply by phone. If you apply by phone, it will take you to the marketplace hotline number. It's staffed 24/7 with real people. So if you call that number at 2 a.m., you will still be talking to a real person. And then applying online, that will start you into the online application process. Okay. There are some other things on healthcare.gov that you can access. You can see there's lots of content at the bottom of the page as well. but I'm going to actually take you to a different website now where you can pull up fact sheets and information pages. So the second website is the CMS Marketplace information page. CMS stands for Centers for Medicare and Medicaid Services, okay? And their health insurance marketplace information can be found at marketplace.cms.gov. So in the middle of the page you can see Get Official Resources. So if you click on that link, it will then pull up a whole list. So you can look at their different publications, you can look at research that they've done, the multimedia page, if you want widgets and badges for your Facebook page or your social media sites. You can get logos, graphics, you can get materials in Spanish, you can get materials in other languages as well. So we're going to go to the publications and articles. So if you click View More, it's going to pull up this whole screen of fact sheets and information pages. You can actually get to the paper application for the marketplace. That is something that folks are deciding to do with the website problems. If you do have someone who is doing a paper application, remind them that if they're doing a paper application, do not go online and start a different application. That's going to slow down the process for them. Just like with Benefit Bank, we don't want to do duplicate accounts. With the marketplace, they don't want to do duplicate accounts either. So we have the applications, but then under Open Enrollment Resources, I found some really helpful things on here. So the first one is Get Covered. It's just a general one-page guide to the health insurance marketplace. I'm going to pull that up really fast. And it is just a brief overview, a general overview of what the marketplace is, the general rules around the dates. You know, if you apply by December 15th, your coverage starts January 1st, open enrollment ends March 31st, okay? So if you just have these sitting out for people to look at, it'll be a great resource for them because it just gives a lot of that good general information. Being a proud Benefit Bank counselor, I know that documents checklist is always an important thing, and the marketplace also has one. So they have a marketplace application checklist, and that's a two-page deal because the first page will be the things that you're going to need to gather excuse me, in order to do an application. The second page is going to be the employer coverage tool. This is helpful for individuals who already have coverage through their employer, but they want to look for plans on the marketplace. This is where you can pull that information together so that when the marketplace asks for it, you have it there already. You don't have to go looking through all your papers for that. So that's a helpful one as well that we always use. If you have folks who are on Medicare who have questions about how the marketplace is going to affect their Medicare, there is a special flyer on that. Okay. The short answer is if they have Medicare, they don't have to do anything because Medicare is not part of the marketplace. Okay. It's not going to affect their choices or their benefits or anything like that. So this is one that I always print out and have ready as well, simply because there's been some confusion around people on Medicare and Medicaid and how the marketplace is going to affect them. I also print out the handout on exemptions. So we've heard that in 2014 you must have insurance or you will be charged that fee. There are going to be folks who qualify for exemptions under that, and so I always have those printed out so that folks can see if they do qualify for that exemption. Now, having health insurance is a very important thing, and we want everyone who wants and needs insurance to get it. But there may be some folks who either can't get it or have, for example, a religious objection, or they are getting insurance through another way, through the VA, through if they're a member of a Native Alaskan tribe or an American Indian tribe, they have their own health system. So those are some examples of exemptions. Also, anyone who is, facing financial hardship and won't be able to afford a plan, those are going to be individuals as well who will qualify for an exemption. So this is a 3-page one, so I just make sure that I always have it stapled and ready to go, but this is really helpful in case people are worried about that fee, while still understanding that having health insurance is very important to them and to their families and communities. So if there is a way to get it, they should, but if for some reason they can't, they may qualify for that exemption. Those are just a few of the resources on this page. I highly recommend that you go through and look at all of them. There may be some that you think are also important to have out. There's also customizable flyers. There are posters. Then if you have small business owners, if they want information on the SHOP, which is a small business health options program, those are plans in the marketplace that small business owners can go and sign up for a plan to offer to their employees. Also, fact sheets back at the top of the page. There's even public service announcements, articles, videos, things like that. So this is a great website to go to if you want to have fact sheets, information flyers to be able to give to your clients and individuals who have questions. The third website I want to take you to is the subsidy calculator, and this is through the Kaiser Family Foundation, and this is a fantastic tool. This is going to be the quick check of the premium tax credit. Okay, so all of our benefit bank counselors out there will know and remember well our lovely quick check feature, and this is what they're using for that advanced premium tax credit. So just like with Quick Check, you're going to be putting in very basic information. It's going to be giving you average, potential, eligibility, and figures. So just like with Quick Check, when you actually go onto the site and put all your information in, it might be a little different, especially if you're just estimating figures here. But what they're going to ask is they're going to ask your state. We're Ohio, and your zip code, and then enter your income, and you have two options, either $2014 or percentage of poverty. Well, most people do not know what percentage of poverty they are, so you'll put it in as your estimated income for 2014. Okay, so we're going to put in an arbitrary number here, say $35,000. They're going to ask, is employer coverage available? No, it is not. Number of people in the family, we're going to say 2. Number of adults who are 21 and older, we'll say 1 adult. And we'll say this individual is 38 and does not use tobacco. Now that's an important question, and you'll see there's a little, just like with Quick Check, if you hover over it, a little box will pop up. And that just says, if you're a resident of a state that does not permit tobacco surcharges, you should select no. Ohio is not one of those places, so it's important to say whether or not you use tobacco. So we'll say no, this individual does not use tobacco. And then the number of children who are 20 and younger who are also enrolling. So we will say 1 child. So this is for a 1 parent, 1 child, and this child does not use tobacco either. May seem like a silly question, but depending on the circumstances, it might be important. So then you click Submit, and then you'll see that it opens up your result. So for a household of 2 at $35,000, they're at 226% of the poverty level. Okay. It's also going to tell you, based on your income, the maximum percentage of your income that you will have to spend on a plan. Okay. That's important for individuals who are very low income and may not be able to find a plan that fits those specifications. You cannot spend more than 8% of your income on a plan and have it be deemed affordable. Okay, so this is where sometimes sticker shock comes in. So here's how to navigate through that. So it's going to tell me that on a benchmark plan, which is the silver level, my plans are going to average, my plan options are going to average around $4,400 a year. However, if you look down at the next level, it says I could receive a government tax credit subsidy of up to $1,900 per year, which would then, that third grouping, mean that for a year of health insurance premiums, my bill would actually be around $2,500. Okay. This is why when you go to that healthcare.gov and you look at just general plans, people can get sticker shock, and that's what they're talking about. So those plans are without the subsidy. This gives me a better idea of what I need to budget for in order to be able to have a plan on the marketplace. Okay. So this is a very helpful tool. Use it just like you use for Quick Check. Okay. And then there's some explanations down here about your results. So it is going to also, you'll go into a little more explanation about those numbers. Okay. So that's the subsidy calculator. That is at kff.org /interactive/subsidy calculator. It's actually listed on the PowerPoint here. So when you look at it, you'll be able to see the actual link for it. All right, and the last website that I have to show you is ohioforhealth.org, and that's run through the Ohio Association of Food Banks. And this is a great website because you have a couple of options that aren't available on those other websites that I showed you. So if you scroll to the bottom of the page, you would see 4 options. I'm ready to enroll. If you click on that, that will take you to the health insurance marketplace. It'll take you to healthcare.gov. If you click I need more information, that's going to bring you to an information page on healthcare.gov. If you click I need assistance with enrollment, this is going to be fantastic because this will actually put you in contact with us, and we can get a navigator in touch with you to help you. So you can either call us through our hotline number, the same hotline you use for Benefit Bank, 1-800-648-1176. You can also visit local help, and I'm going to show you that in a second. And then you can go to our enrollment events, also going to show you that in a second, or you can just use this online form, which is just your name, your email, your phone number, and a quick message. So if I wanted to say that, you know, I need more information on how insurance plans even work, you can just put that in there, the message will come to us, and then you will hear from us with more information, and we can help you through that. Back on that main page, the last option is I'm interested in attending an enrollment event. So we have enrollment and information sessions set up all over the state, as you're going to see in a second. So you are able to search either by calendar or by map. So I'm going to click on the map here. Okay. So if I then say I'm down in Southern Ohio, okay, if I click on this one right here, I see that in Sciotaville, on the 2nd, there is an enrollment event. It's actually one of Gail's tax credit outreach workshops where there will be a navigator available. Okay. If I click on the one next to it, there's one in Portsmouth on December 9th, which is going to be a full enrollment clinic just for Marketplace. So it's not going to be one of those partnering with tax clinics. Okay. And if you sort of scroll through things, you're going to see that we have all the way up through V, it looks like. So we have, at this point, and we're adding more every day, we have over 20 enrollment or information sessions going on right now. Okay. So if it's better for you to look at it in the map view, you can do that, or if I want to switch to calendar view, I just click on calendar, and then I can see that next week we're going to be all over the place. We're going to be in Columbus, we're going to be in Albany, we're going to be in Athens, something that you can also point your clients to as well if they want more information or if they want more help. You can see if we're going to be in your area in the upcoming days. And that's at ohioforhealth.org. All right, I'm going to pass it back to Gail, who's going to talk about some more things. I may have stolen her thunder on one of the slides coming up, but we'll see. So like I said, I can be reached through the hotline number 1-800-648-1176. If you've forgotten me, I'm Jessica, and I'm glad to be back and helping out our friends and family and neighbors, and I hope to hear from you soon.
Great. Jessica, I have a question. Um, and you may have said this, I just may have gone to sleep for a minute. If I am a site and I want to have a navigator attend a tax clinic, for example, on February 2nd, or is it February 1st this year? February 1st is our kickoff, our Free Your Tax Ohio kickoff day. And a number of sites will have large tax clinics with resources and what have you. The question is, how do I request to have a navigator at that event?
That's an excellent question, Gail, and I actually did not mention that, so I'm glad that you did. Up at the very top of the screen at ohioforhealth.org, you will see there's a link that says Host an Event. If I click on that, there's actually a form to fill out, which is my name, my phone number, and there's actually several pages worth. So that's where you can actually go and say, I'm having an event, I would like you to be there, I'm having an event, I would like you to send me flyers. What's going to happen is when we get these responses, you're probably going to be hearing from Tyler Davis. And he's the one that schedules a lot of these events. He's really good at it, so he will be in contact with you as well, just talking about what your event's going to be like, what you're going to need, what your needs are, what we can provide for you. So that's at the top of the page if you just click Host an Event.
Great. I have another couple of questions here. You mentioned earlier about you could use the phone to apply for health care. With what is going on right now, with the slowness of the online, would that be best, do you think, if we take that route right now, if we want to make sure that we have insurance coverage that will begin on January 1st?
Absolutely, and that's what we're telling individuals as well. So the marketplace, while they do use healthcare.gov, they actually have a backdoor to it. So the website issues that we as consumers and navigators are experiencing, they are not, because they can choose another way to go in there. So if you have someone who just wants to get it done today, they want to get it done now, they don't want to wait for the website to stabilize, you can always send them to the marketplace hotline number. And so I'm going to pull that up so individuals can see it. Okay. And that number is 1-800-318-2596. And like I said, they're available 24/7, staffed by real people, so they can call at any time. And that's what we are suggesting to folks who are calling in and saying, I need help with this and I want to do it, I don't want to do it right now. We'd send them to the marketplace hotline.
Great. Another question that I hear quite often when we speak about the health care is, you have that tick that says, do you smoke or do you use tobacco? Okay. First thing people will ask is, how will they know if I use tobacco or not? Has the healthcare.gov, have they addressed that? Do you know the answer to that?
I do not, but I'm actually going to be looking into that. How it has historically worked with health insurance is that if you end up with some kind of diagnosis that is because of tobacco use, that then will come back on you and, and it'll be very bad. So I'm going to look into that more, and I'll find out the exact the exact way that they know, and they're not going to look into receipts and see if you purchased Marlboros last week or something like that. They're not going to be that invasive or anything. But how it has historically worked is that if you have smoking or other tobacco, chewing tobacco, cigar-related illnesses or diagnoses, that then that makes things unpleasant for you. So I will check into that.
Okay, thank you. Yeah, I get that question a lot. How are they going to know? Oh, I have no clue. So here is our contact information. Please feel free to contact us at any time. I do want to explain to you how here in Franklin County we have an event that will be on the 9th. I think the first event is actually going to be in Scioto, Potter's House. What you will want to do is to look at what resources that you have available. I think the most important things that we can do is to make sure that the client is aware whether or not he or she may be eligible for the tax credit, and you do that through the Kaiser site that Jessica showed you, and also to give them an idea so they can go through that site to see what plans they may be eligible for, that they may be able to look at. The reason why I say that is that when they get to speak with the navigator, we have very limited navigators throughout the state. Well, we have limited navigators throughout the country, really, to be quite frank with you. Our grant allowed us to hire between 20 and 30 navigators. And that is not just navigators working here in Franklin County. That's navigators that are to be spread out all across 88 counties. Okay? And then there are limited amount of CACs working. With that being said, at our clinics, I am hoping that with the use of these tools, when the client comes to the clinic and they're hesitant on whether or not they are actually ready to sign up right now, then that's when you can walk through with them with these additional sites and these additional helps. And that person does not need to be a certified OBB tax counselor. They can be a volunteer from the community that wants to just be able to help, so that when they finish speaking with that person and then they're like, okay, now I'm ready to sign up, okay, that is a perfect time to send them to the navigator. So you really do not, if you only have one navigator at your site and you have like 25 appointments, you don't want to push all 25 people to the navigator. Some people are not ready to sign up yet. Some people may not be ready until they have till March. Okay, so because of that, we want to be able to help like funnel and make sure that when the person gets to the navigator, they are ready. Another thing that you're going to want to be clear with your clients are that when they sign up with the navigator, they need to be ready to make a premium, that first premium payment, okay? That first premium payment. When you are working a job, and let's say you started working this month at McDonald's, okay? And it's lunchtime, so I'm hungry. So let's say you started working at McDonald's this month, and they told you that your medical coverage would not begin until November. The reason why is that they need to make your first premium payment before your insurance actually kicks in. That's the same way with this marketplace. Okay, that's the reason why I'm saying some people may not even be ready until March because they need to either save up some money or wait till their income tax refund comes in, something, so that they can make that first initial premium payment. So, and then also another way that you can help your clients is to make sure that they have a debit card or some kind of bank account. Now, if they do not have a bank account, and you want to be able to offer a prepaid debit card, if you contact me, I can get you hooked up with the U.S. Bank prepaid debit card. There are no fees with that debit card, um, and they do direct deposit. You can make your premium payments off of that. You will receive uh, a routing number, an account number, so that they can sign up and have their payments paid that way, because you cannot pay with cash. And Jessica, I don't know, are they taking checks, or are they only taking debit cards or bank accounts for that payment?
That's going to depend on the plan. When you get to the actual payment page on the marketplace, it will tell you, there will be a button that will say, pay now electronically, or if there is a mail-in option, it will give you the address and also your due date. So I'm glad that you mentioned that, Gail, about that first month's premium. You are not technically enrolled in a plan until you've actually paid that first month premium, and they'll have a due date of, if you want your coverage to start January 1st or whatever your start date is. You need to make your payment by, X date. So it's really going to depend on the plan. The most obvious and most beneficial one to pay with is online, but we know that for some folks that's not how they handle payments.
Right, exactly. So just make sure that they understand that when before they go to see the navigator. Okay. I think that's about all that I have to cover today. If you, like I said, if you have any questions, if there's something we did not cover, please feel free to email us. We will be doing several more of these as time goes on. So please check back to see what webinars that we have put together. If there's any subject about whether it's healthcare, taxes, please let us know if there's a subject that you would like for us to cover or a topic. I also want to let you know that Lisa, our executive director, right before I came down to do this webinar, she wants us to host a webinar on explaining how to get a client's Medicaid application through the benefit bank. That, as you all know, okay, let me back up a little bit. As you all know, or you may not know, the controlling board approved the Medicaid expansion. Yay! Yay! We are very excited about that around here. So JFS has not quite made a ruling, and I think there's some kind of conference call going on this afternoon, a ruling on how they are going to accept those applications. So, but we will be able to do them through the benefit bank. Yay! So with that being said, we have a segment of population of our clients that actually need the Medicaid expansion. So we are going to host a webinar on that, on the process of that, and how it can be handled. Okay, so look for that webinar coming up sometime in the very near future. So with that being said, Jessica, did you have anything final that you wanted to throw in?
Just that as a navigator, I am a resource to individuals, and so feel free to reach out to me if you have any more questions. Also, if you are wanting to host an event, please use that host event feature. We really want to be able to have as many of those events as possible throughout the state to get our friends and family and neighbors the health insurance that they need.
Okay then. Well, thank you very much, and thank you very much for listening today, and give us a holler if you have any questions. So that'll be it for today, and I hope that you enjoy the rest of your day. Thank you very much. Goodbye.